Hospice of Salina is the only nonprofit hospice in Salina and the surrounding area. I'm Rebecca Hansen, Clinic Manager of Hospice of Salina.
Rebecca, thank you for coming on the show to talk about Hospice of Salina. First of all, tell us about hospice.
Hospice is a discipline where nurses, doctors, social workers, and chaplaincy take care of patients and their families as they have a terminal diagnosis and help them navigate until end of life.
And I know Hospice of Salina has something to be proud of with the recent Medicare survey. Why don't you talk about that?
Yes, Mike, we recently had a survey come through and they looked over all of our documentation, our processes, and just to ensure that we're following the Medicare standards for quality of patient care. And we received 0 deficiencies.
So then let's talk about the process of somebody deciding to come into hospice.
Sure, Mike. Usually it is somebody who has been living with a chronic condition for several years. Some of the diagnoses are COPD, congestive heart failure. Of course, there's a cancer diagnosis when it's not responding to treatment. Those are all things that as the disease process progresses, physicians aren't able to manage that patient's symptoms any longer. They're not able to make them better or have them feel comfortable within that disease process. And so that's a time when you might want to think about hospice. Hospice is comfort care. So we help the patient be comfortable and manage those symptoms as are related to their disease process.
Okay, and I know you don't ignore the family in this process as well because they play an important role in it, correct?
Correct. We take care of the patient and manage their symptoms. We also help the family members. Being a caregiver is very stressful, or can be. It's very emotionally taxing as well as physically stressful. So hospice is multidisciplinary. We have nursing, social services, chaplaincy, and of course the medical aspect from our medical director or the patient's primary care. It's a holistic group that covers the patient, the psychosocial, the spiritual, kind of all rolled into one as that patient navigates their end of life.
Thank you for watching. For more information, please visit hospiceofsalina.org, and you can like them on Facebook as well.